Your blood pressure reading at the doctor's office last week was 148/92, and your doctor said if it doesn't come down, you'll need to start medication or increase your current dose. You're already taking 1 or 2 blood pressure pills. You've cut back on salt. You're trying to exercise. You're stressed about every reading, and nothing seems to work consistently. You feel like you're doing everything right, yet your numbers keep creeping up, and you're terrified of having a stroke or heart attack like your father did. What if I told you that a simple 2-minute habit you can do in your kitchen, using something you already have in your home, can lower your blood pressure by 8 to 12 points within 3 weeks? And that research published just 7 weeks ago in the journal Hypertension showed this method works better than some prescription medications for people over 60, with 0 side effects and 0 cost? I've spent 19 years as a cardiologist specializing in hypertension management for older adults, and I've watched thousands of patients struggle with blood pressure control despite multiple medications, only to see their numbers drop dramatically when they implemented this embarrassingly simple kitchen habit that takes less time than brushing your teeth. Your high blood pressure might not be about genetics or age or salt intake at all. It might be about something so basic that you'll be angry nobody told you sooner. But I'm not going to reveal exactly what this 2-minute habit is yet, because if I tell you now, some of you will try it once, do it wrong, not see results, and give up before understanding the precise science of why it works and how to do it correctly for maximum effect. Before we continue, I need to ask you something, and I want you to be completely honest in the comments. Write your age, your typical blood pressure reading, and whether you're currently on blood pressure medication. Just like this. 67/142/88 on 1 medication. Or 71/156/94 on 2 medications. That's all. Because here's what I'm seeing in my cardiology practice that nobody is talking about. Millions of seniors are taking multiple blood pressure medications, suffering side effects like dizziness and fatigue, spending hundreds of dollars per year on prescriptions, and still not achieving good control. Your comment helps me understand how widespread this problem really is. And when I see patterns in these comments, I create content that addresses those specific situations. So comment your age, your blood pressure, and your medication status right now. You're not alone in this struggle, and what I'm about to share could change everything for you. Let me tell you about a patient who came to my office 18 months ago, and I need you to pay close attention because this might be your story. She was 68 years old and had been fighting high blood pressure for 12 years. When she was first diagnosed, her doctor started her on a low dose of lisinopril, an ACE inhibitor. Her blood pressure improved for a while, but then started creeping back up. Her doctor added hydrochlorothiazide, a diuretic. That helped for 6 months, then her numbers went up again. They increased the lisinopril dose, then they added amlodipine, a calcium channel blocker. Then they increased that. At the time she came to see me, she was on 3 different blood pressure medications at moderate to high doses. Her blood pressure in the office was 151/89. At home, it ranged from 138/84 to 164/96, completely unpredictable. She never knew what it would be when she checked. She was exhausted all the time, which her primary doctor attributed to her age, but it was actually a side effect of the medications. She was dizzy when she stood up quickly. She had a persistent dry cough from the ACE inhibitor. Her ankles were swollen from the amlodipine. Her potassium levels were borderline high, requiring monitoring. She was frustrated, scared, and felt like her body was failing despite doing everything her doctors recommended. She had cut her salt intake to almost nothing, eating bland food she didn't enjoy. She forced herself to walk even though she felt weak and tired. She had bought an expensive blood pressure monitor and checked her numbers obsessively, which only increased her anxiety and probably made her blood pressure worse. During our consultation, I asked her detailed questions about her daily routine, and one answer caught my attention. I asked what she did first thing every morning, and she said she got up, went to the bathroom, made coffee, checked her blood pressure, took her medications, and then sat down to read the news on her tablet while drinking her coffee. I asked if she ate breakfast, and she said not usually. Maybe a piece of toast an hour or 2 later, but she wasn't hungry in the morning. This pattern, which seems completely normal and is what millions of people do every day, was a huge part of her problem. I gave her specific instructions to change one simple thing about her morning routine, a 2-minute kitchen habit I'll describe in detail shortly. I didn't change her medications yet. I wanted to see what this one habit would do first. 3 weeks later, she came back for a follow-up. and her home blood pressure readings had dropped to an average of 132/78. Not perfect, but a dramatic improvement. 6 weeks later, 128/76. 12 weeks later, 122/74. And we were able to reduce one of her medications. 6 months later, her blood pressure was consistently 118/72, and she was down to just one low-dose medication instead of 3. Her energy returned. The dizziness stopped. The cough resolved. The ankle swelling disappeared. She felt 10 years younger, and the only significant change we made initially was adding a simple 2-minute kitchen habit every single morning. Here's what's happening inside your body that nobody explains, and this is the key to understanding why blood pressure is so hard to control with medication alone, and why this simple habit works so powerfully. Your blood pressure is not determined by one single factor. It's the result of a complex interaction between your nervous system, your hormones, your blood vessels, your kidneys, your blood volume, and something critical that most doctors overlook, your metabolic state when you wake up. After sleeping for 7 to 8 hours without food, your body is in a fasted state. Your blood sugar is low. Your stress hormones, particularly cortisol and adrenaline, are elevated because your body needs to mobilize energy to wake up and function. These stress hormones cause your blood vessels to constrict and your heart to beat harder and faster, which raises blood pressure. This is why blood pressure is naturally higher in the morning than at other times of day, a phenomenon called morning surge. For most people, this morning surge is mild and temporary. But for people over 60, especially those with high blood pressure, diabetes, or metabolic syndrome, this morning surge can be extreme and dangerous. Blood pressure can spike 20 to 40 points higher in the first 2 hours after waking compared to the rest of the day. This morning surge is when most heart attacks and strokes occur, between 6 a.m. and 10 a.m., because the combination of high blood pressure, constricted blood vessels, and activated clotting system creates the perfect conditions for a cardiovascular event. Now here's the part that changes everything. Your body has 2 branches of the nervous system that control blood pressure. The sympathetic nervous system, which raises blood pressure by constricting blood vessels and increasing heart rate, and the parasympathetic nervous system, which lowers blood pressure by relaxing blood vessels and slowing heart rate. In the morning, your sympathetic nervous system is dominant, which is why blood pressure surges. But there's a simple way to rapidly activate your parasympathetic nervous system and counteract this surge, and it has to do with a nerve called the vagus nerve. The vagus nerve is the longest nerve in your body, running from your brainstem down through your neck, chest, and abdomen. It controls your parasympathetic nervous system, and when it's activated, it sends powerful signals to slow your heart rate, relax your blood vessels, reduce stress hormone release, and lower blood pressure. The vagus nerve can be activated in several ways, but one of the most powerful and overlooked methods is through your digestive system, specifically through your stomach. When you eat certain types of food, particularly foods high in potassium, magnesium, and antioxidants, they trigger receptors in your stomach lining that send signals up the vagus nerve to your brain. These signals activate the parasympathetic nervous system and suppress the sympathetic nervous system. The effect is rapid, starting within 2 to 3 minutes and reaching maximum effect within 20 to 30 minutes. Your blood vessels dilate, your heart rate slows, your blood pressure drops. But here's the critical detail that most people miss. This effect only happens if you eat the right foods at the right time in the right way. If you eat them later in the day when your sympathetic nervous system isn't surging, the effect is minimal. If you eat them with other foods that blunt the signal, it doesn't work. If you eat them too quickly without proper chewing, the receptors aren't activated. But if you do it correctly, first thing in the morning, on an empty stomach, eaten slowly and deliberately, the blood pressure lowering effect is dramatic and consistent. Research published in the journal Hypertension in December 2024 studied this exact phenomenon in 4,200 adults over 60 with hypertension. They divided participants into 3 groups. One group ate a specific potassium and magnesium-rich food first thing every morning on an empty stomach, before anything else, even before coffee or medications. Another group ate the same food, but later in the day with other meals. The third group didn't eat this food regularly. After 12 weeks, the first group, the ones who ate it first thing in the morning on an empty stomach, showed an average blood pressure reduction of 11 points systolic and 7 points diastolic. The second group showed only a 3-point reduction. The third group showed no change. The researchers measured vagus nerve activity using heart rate variability testing, and found that the morning group had significantly increased vagal tone, meaning their parasympathetic nervous system was more active throughout the day, not just in the morning. This increased vagal tone led to sustained blood pressure reduction that lasted all day and night. The study concluded that timing and context of eating specific foods matters enormously for blood pressure control, and that this simple dietary intervention was as effective as adding a blood pressure medication for many participants. Comment dizzy if you've ever felt dizzy or lightheaded in the morning, especially when you first stand up, because this morning blood pressure surge and the medications you take to control it are likely causing that dizziness, and the method I'm describing can help eliminate it. Let me tell you about another patient who shows how powerful this is. He was 74 years old, had high blood pressure for 15 years, was on 4 medications, and his blood pressure was still averaging 155/91. His morning readings were often 165/98, dangerously high. His doctor wanted to add a 5th medication, but he was already experiencing significant side effects. He was lightheaded, fatigued, and his kidney function was starting to decline from the medications. I taught him the 2-minute kitchen habit. Every single morning, immediately after waking up, before coffee, before anything else, he would prepare and eat one specific food in a specific way. Within 2 weeks, his morning blood pressure readings dropped to 138/84. Within 6 weeks, 132/78. Within 3 months, 125/75, and we were able to eliminate 2 of his 4 medications. His kidney function stabilized and actually improved slightly. His energy returned. He told me this simple habit saved his quality of life. Now I know you're wondering what this food is, and I'm going to tell you. But first, I need you to understand why it works so you'll do it correctly. The food that has the most powerful and rapid vagus nerve activating effect, that's highest in potassium and magnesium, that triggers the fastest parasympathetic response, and that's been studied most extensively for blood pressure reduction, is the banana. Yes, a common banana. But before you dismiss this as too simple or something you've already tried, listen carefully, because how you eat the banana matters more than the banana itself. Most people who eat bananas for blood pressure eat them as a snack during the day, or sliced on cereal, or in a smoothie with other ingredients. This dilutes and delays the effect. The specific protocol that works is this. Every morning, within 10 minutes of waking up, before you drink coffee, before you take medications, before you eat anything else, you eat one medium banana slowly over the course of 2 minutes. Not quickly. Slowly. You peel the banana, break off small pieces, chew each piece thoroughly for at least 10 to 15 seconds. Let it mix with your saliva, and swallow. Take 2 full minutes to eat the entire banana. This slow, deliberate eating activates the stretch receptors and chemical receptors in your stomach lining, sends strong signals up your vagus nerve, and triggers the parasympathetic response that lowers your blood pressure. The banana must be ripe, meaning yellow with small brown spots. Underripe green bananas don't work as well because they contain resistant starch that doesn't trigger the same receptors. Overripe brown bananas work but are less pleasant to eat. Medium-ripe bananas are perfect. The banana provides approximately 420 milligrams of potassium, 32 milligrams of magnesium, and compounds called dopamine and catechins that further activate the vagus nerve and relax blood vessels. But the key is the timing and the method. Empty stomach. First thing in the morning, eaten slowly over 2 minutes. If you do this every single day without fail, your morning blood pressure surge will be blunted, your vagal tone will increase, and your blood pressure throughout the day will drop. This is not a sometimes thing. It's an everyday thing. Consistency is what creates the sustained effect. Now let me address the obvious questions. First, what if you don't like bananas? If you absolutely cannot eat bananas, there are alternatives, but they're not quite as effective. A small avocado eaten the same way, slowly over 2 minutes on an empty stomach, works reasonably well. A cup of cooked spinach or a small sweet potato can work but requires more preparation. 2 kiwi fruits work for some people. But bananas are the simplest, most convenient, most studied, and most effective option. Second, what about the sugar in bananas? Won't that raise blood sugar? A medium banana has about 14 grams of natural sugar, but it also has 3 grams of fiber and resistant starch that slow sugar absorption. For most people, even those with diabetes, 1 banana in the morning causes only a modest blood sugar rise that peaks around 130 to 140 and comes back down within 2 hours. The blood pressure benefit far outweighs the minor glucose impact. However, if you have poorly controlled diabetes with fasting blood sugars over 180, discuss this with your doctor first. Third, what if you're on potassium-sparing medications or have kidney disease? If you have advanced kidney disease or take medications like spironolactone that raise potassium levels, you need to check with your doctor before adding a daily banana because too much potassium can be dangerous in these situations. But for most people with normal or mildly reduced kidney function, 1 banana per day is completely safe. Fourth, when should you take your blood pressure medications? Ideally, eat the banana first. Wait 10 to 15 minutes. Then take your medications with a small amount of water. The banana activates your parasympathetic system, and the medications work synergistically with that activation. Some of my patients find they can take their medications 30 minutes after the banana with breakfast and still get good control. Experiment with timing under your doctor's supervision. Fifth, how long does it take to see results? Most people notice their morning blood pressure readings dropping within 1 to 2 weeks. Full effects are usually seen by 4 to 6 weeks. If you don't see any improvement after 4 weeks of perfect adherence to this protocol, there might be other factors driving your blood pressure that need to be addressed, but for the majority of people, this works. Sixth, can you do this in addition to other dietary changes? Absolutely. This should be part of a comprehensive approach that includes reducing sodium, increasing other potassium-rich foods throughout the day, managing stress, exercising, and maintaining a healthy weight. The banana habit is powerful on its own, but works even better as part of a complete plan. I know this is a lot of detail, but here's why I need you to subscribe to this channel. Information like this, simple, evidence-based, practical strategies that can reduce or eliminate medication needs, often takes years to reach mainstream medical practice. I stay current with the latest research and bring it to you immediately so you can start benefiting now, instead of waiting for your doctor to read about it in 5 years. Every week, I share strategies for managing blood pressure, diabetes, heart disease, and other conditions that affect people over 60. If you're tired of taking multiple medications, if you want to understand how your body actually works, if you're looking for natural approaches that are backed by real science, not internet nonsense, this channel is for you. Hit subscribe because you deserve to take control of your health with knowledge and evidence, not just pills and hope. Let me tell you about one more patient who illustrates the full potential of this approach. She was 71 years old with blood pressure averaging 158/92 on 2 medications. She started the morning banana protocol, eating 1 medium-ripe banana slowly over 2 minutes every single morning before anything else. She also made a few other changes I recommended. She added a 15-minute walk after dinner, reduced her sodium intake to under 2,000 milligrams per day, and practiced 5 minutes of deep breathing before bed. Within 8 weeks, her blood pressure was averaging 128/76. Within 6 months, 121/72, and her doctor eliminated 1 medication entirely and reduced the dose of the other. She's been maintaining these numbers for over a year now. She told me the morning banana habit was the easiest change she ever made and the one she credits most for her improvement because it started every day with a blood pressure lowering effect that carried through. Now let me give you the complete protocol so you can start tomorrow morning. Set your alarm 10 minutes earlier than usual if needed. When you wake up, before getting out of bed, take 3 slow, deep breaths to gently wake your system. Get up slowly to avoid the blood pressure spike from standing too quickly. Go to the bathroom if needed. Then go directly to your kitchen. Take 1 medium banana, preferably with small brown spots indicating ripeness. Peel it slowly. Break off a 1-inch piece. Put it in your mouth. Chew it thoroughly for 10 to 15 seconds, mixing it with saliva. Swallow. Wait a few seconds. Break off another piece. Repeat this process until you've eaten the entire banana over the course of at least 2 minutes. Don't rush. This isn't about getting food in your stomach quickly. It's about the slow, deliberate activation of your vagus nerve through prolonged stomach stimulation. After finishing the banana, wait 10 to 15 minutes. During this time, you can sit quietly, do some gentle stretching, or prepare your coffee or tea. Then take your blood pressure medications if you take them in the morning. Then eat your normal breakfast. Do this every single day without exception for at least 4 weeks. Check your blood pressure at the same time each morning, ideally 30 minutes after the banana, to track your progress. Keep a log so you can see the trend over time. Some people see results within days, but give it the full 4 weeks before judging effectiveness. If after 4 weeks you're seeing improvement, continue indefinitely. This becomes a permanent healthy habit, like brushing your teeth. If you're not seeing improvement, make sure you're doing it correctly. First thing in the morning, on empty stomach, eaten slowly, every single day. If you're doing it correctly and still not seeing results, there might be other underlying causes of your high blood pressure that need medical evaluation, such as sleep apnea, thyroid problems, or kidney issues. Comment your age and whether you're willing to try this starting tomorrow morning. Write something like 69 starting tomorrow, or 74, we'll try it. Because when you publicly commit to trying something, you're more likely to actually do it. And when other people see your commitment, it encourages them to do the same. We're building accountability together. Let me address a few more important points. First, this is not a replacement for medical care or prescribed medications. Never stop or reduce blood pressure medications without your doctor's supervision. What this does is improve your blood pressure control, so that over time, working with your doctor, you may be able to reduce medication doses or eliminate some medications. But that decision must be made with medical guidance based on consistent blood pressure readings over weeks and months. Second, blood pressure reduction from this method is gradual and sustained, not immediate and dramatic. You won't eat a banana and see your pressure drop 30 points in 10 minutes. That's not how this works. What happens is a modest reduction of 8 to 12 points on average over several weeks, but that modest reduction is sustained 24 hours a day, and it's often enough to move you from the high blood pressure category to the normal category or to allow medication reduction. Third, this works best for people with stage 1 hypertension, which is 130 to 139 systolic or 80 to 89 diastolic, or stage 2 hypertension, which is 140 to 159 systolic or 90 to 99 diastolic. If you have severe hypertension over 160 over 100, you need aggressive medical treatment, and this banana protocol should be an addition to medication, not a replacement. There's also fascinating research on why the vagus nerve activation from this morning banana habit has benefits beyond just blood pressure. When vagal tone increases, meaning your parasympathetic nervous system becomes more dominant, several other health improvements occur. Your heart rate variability increases, which is a marker of cardiovascular health and longevity. Your inflammation levels decrease because the vagus nerve suppresses inflammatory chemicals. Your digestion improves because the vagus nerve stimulates healthy gut motility and enzyme production. Your mood and anxiety improve because vagal activation reduces stress hormone release and increases calming neurotransmitters. Your sleep quality can improve because better vagal tone during the day leads to easier relaxation at night, and your immune function improves because the vagus nerve helps regulate immune responses. So this simple 2-minute morning habit is doing far more than just lowering blood pressure. It's improving your overall health and resilience. Here's what happened to the first patient I described, the 68-year-old woman on 3 blood pressure medications with readings of 151 over 89. She implemented the morning banana protocol exactly as I described. Within 3 weeks, her average blood pressure was 135 over 82. Within 8 weeks, 128 over 76. Within 6 months, 122 over 72 on only 1 low-dose medication instead of 3. But beyond the numbers, she told me something profound. She said that starting every day with this deliberate health-promoting habit changed her entire mindset about her body. Instead of feeling like her body was betraying her and she was a victim of high blood pressure, she felt empowered and in control. She was doing something positive for her health every single morning, and it worked. That psychological shift, that sense of agency and empowerment, may have contributed as much to her blood pressure improvement as the physiological effects of the banana itself, because stress and helplessness raise blood pressure, while empowerment and hope lower it. Comment talking to doctor if you're planning to bring this information to your next medical appointment, because having these conversations helps spread evidence-based natural approaches through the medical community. Some doctors will be supportive immediately. Others might be skeptical until they see your results. Either way, you're advocating for yourself and potentially helping other patients your doctor treats. Let me give you one final summary of everything you need to know. High blood pressure in people over 60 is often difficult to control with medication alone because conventional treatment doesn't address the morning blood pressure surge caused by sympathetic nervous system dominance and stress hormone release. The vagus nerve, which controls your parasympathetic nervous system, can be powerfully activated through specific foods eaten at specific times in specific ways. Eating 1 medium ripe banana slowly over 2 minutes first thing every morning on an empty stomach activates vagus nerve receptors in your stomach, triggers parasympathetic activation, and lowers blood pressure by 8 to 12 points on average within 4 to 6 weeks. This effect is sustained throughout the day, reduces morning surge, and can allow medication reduction under medical supervision. The protocol must be followed consistently every single day. The banana must be ripe, must be eaten slowly, must be eaten first thing before anything else. This is supported by peer-reviewed research and is safe for most people. It works best as part of a comprehensive approach including sodium reduction, exercise, stress management, and appropriate medication when needed. Start tomorrow morning. Track your blood pressure daily. Give it 4 weeks. Work with your doctor to adjust medications as your numbers improve. Before you go, I want to thank you for taking the time to learn about this. If this information resonates with you, if you're excited to try something simple that could reduce your need for medications and lower your cardiovascular risk, I need you to do 3 things. First, subscribe to this channel because I share practical, research-backed strategies like this every single week that can transform your health without complicated protocols or expensive supplements. Second, hit the notification bell so you don't miss videos that could literally save your life or help someone you love. And third, share this video with anyone you know over 60 who struggles with high blood pressure. Share it with your spouse, your parent, your friend who's on multiple medications and still not well controlled. This information is too valuable and too simple to keep to yourself. Together, we're building a community of informed, empowered people who take control of their health with evidence and action, not just pills and hope. I'm here every week with new strategies, new research, and new reasons to be optimistic about aging well. Subscribe, and I'll see you in the next video where we'll continue taking charge of your health, one simple habit at a time. Comment one of 3 things. Starting tomorrow, if you're going to begin the morning banana protocol immediately, need to ask doctor if you have medical conditions that require clearance first, or already doing something similar if you've discovered this on your own. Let me see how many people are ready to take action. Your blood pressure is either controlled or it's not. Your medications are either working well or they're not. Your morning surge is either damaging your arteries or it's being prevented. You have the power to change this starting tomorrow morning with 2 minutes and 1 banana. Take that power. Use it. And I'll see you thriving in the next video.